breakdown, Republicans' efforts to cut fraud and abuse of Medicaid could leave 190,000 Louisianans without health insurance. We're talking about President Trump's One Big Beautiful bill, which could cut about $1 trillion from Medicaid and food stamps. For the first time, it would implement nationwide work requirements for Medicaid. Adults without children would have to prove they work or volunteer at least 80 hours a month. And while seniors and those with special circumstances would be exempt, a lot of the specifics would have to be ironed out by individual states. The nonprofit Kaiser Family Foundation projects that 190,000 people in Louisiana, or possibly as many as 230,000, would lose their insurance. House Speaker Mike Johnson of Louisiana denied that on Face the Nation.
How do you defend that to your constituents?
We have not cut Medicaid and we have not cut SNAP. What we're doing, Margaret, is working on fraud, waste, and abuse. And everyone in Louisiana and around the country understands that that's a responsibility of Congress. Just in Medicaid, for example, you've got 1.4 million illegal aliens receiving those benefits. You got about 4.8 million people on Medicaid right now nationwide who are able-bodied workers, young men, for example, who are not working, who are taking advantage of the system.
Let's give all of that some context. First, undocumented immigrants are not eligible to enroll in Medicaid. And about 64% of the 79 million people enrolled in Medicaid have jobs. Only a small percentage don't meet work, school, disability, or caregiver requirements. So why is it that the Congressional Budget Office estimates up to 13.7 million people would lose medical insurance if this bill passes as is? The short answer is red tape and paperwork. Low-paying jobs can be unstable or inconsistent. They can be tougher to find in rural areas, or gig workers don't always have documentation of steady monthly hours. An implementation of this policy in Arkansas showed the burden and confusion of jumping through new hoops resulted in many people losing their coverage. The House has passed the reconciliation package, and it now goes to the Senate.